We have another question. Sorry, back here. Yes.
Al Milliken, Washington Independent Writers. Critics of Social Security, I have heard talking about it as a Ponzi scheme. Wondering how you would address that, and also I've heard groups like particularly African American men, they've benefited financially much less than other segments of society from Social Security. And how do you see that?
Yeah, would you, Nancy?
Let me address your second question first, and that is that it is true that African Americans, because their longevity is much less than white Americans, receive less from the retirement income part of Social Security. And that, I think, is a travesty of the nation. I think we've got to do something in our health care to provide infant prenatal care and so forth to the African American and other populations, so that the longevity of those people is as high as it is for everyone else. What people miss, though, when they criticize Social Security on that, is that African Americans, because of the same thing, get a much higher percentage of disability benefits than white Americans, because they become disabled much more frequently for the same health reasons. They tend to die younger and and their children receive survivor benefits. So I think, I've forgotten the figures, but I think it's African American children are something like 13% of the population and get about 23% of Social Security's survivor benefits. So when it all evens out, they get, African Americans, as well as every other American in this country, gets a very good deal from Social Security. But the real issue and the real point, I think, and the important point that your question raises, is that we have to do more for improving the health care of every citizen of our nation. Now, the Ponzi scheme, that's this pay-as-you-go system, there are a number of responses to that. First of all, prior to the enactment of Social Security, people worked as long as they could. Those who couldn't, and not everyone can work forever, generally moved in with their children. You can consider that a Ponzi scheme, that the younger generation is taking care of the older generation. And you can see, in some sense, Social Security as just a way to equalize that. The children are taking care of their parents, but some people who don't have, why should one person who doesn't have children wind up in the poorhouse and somebody else who has 5 children has the burden spread? It's a way to spread the burden more evenly. So that's one response, that it's what you can pejoratively call a Ponzi scheme is what Social Security, the concept of all of us joining together and assisting those who need money because they've lost wages as a result of disability, death, or old age. But the other point is that the Ponzi scheme concept, we have to catch up with what's been happening. The 1983 amendments started to shift the system over to a funded system. Not a fully funded system, but a partially funded system. As I say, in 10 years, Social Security's surplus will have built to $4.5 trillion. If we invest that money wisely, we can pay these additional costs that will come from the aging of the population, and do it in a way that doesn't burden the younger generation, but spreads the costs, as we always have done, very equitably.
Ryan Ellis to respond.
For the second part on the Ponzi scheme, I think I would refer you to what Patrick had mentioned in his prepared remarks, which I think dealt with it quite well. It's a simple matter of mathematics, that you keep paying for people that are older than you, and you hope that younger people behind you are going to pay for you. That's all well and good, except in a world of a declining fertility rate, where there aren't going to be enough younger people by the time you get to be old enough, which is the world that we're in, and that's what we're dealing with. More interesting question is on the African American question, I think. It strikes me as a rather indirect way of helping this problem is helping African American health care. A much more direct way of dealing with this problem is simply letting African Americans keep the money that they're spending in Social Security. If they were able to put their 10% of the old age and survivors insurance payment, separate from the disability insurance payment, by the way, which is not what we're talking about today, If they're able to put that 10 percentage points into a personal account that they own and control, a couple of good things happens. One, the primary fear that blacks in this country have, that they are not going to live long enough to collect their Social Security benefit, goes away, because their Social Security benefit, or at least the discounted present value of it, is growing and earning interest in a personal account that they own and control. And secondly, it would start a sea change within the African American community of being able to actually transfer wealth intergenerationally. Right now, blacks tend to have a series of perfect storm factors affecting them. One is they earn less. Two is they live a less amount of time. Both of those conspire to the fact that they can't save enough money. Much less for themselves, but they certainly can't save enough money to keep within their communities and to pass along to their children or to whoever else they would want. This would serve as a starting point, putting aside 10% of their income in an account they own and control that could then roll into their children or grandchildren or wives or anyone they want within their community. Within their account would actually begin some savings, and it would do probably more good than any other